There's something that's been going on in the health sector, in some private hospitals for a very long time. And I think it's high time we talked about it. Why is it that some hospitals do not want their patients to know what they are taking? I'm talking about medications. My cousin have been having some health issues, and naturally I got curious as far I'm a pharmacist and a concerned family member. I decided to check her drugs to see what medications she's placed on. To my surprise, these drugs were dispensed in a transparent envelope. It's very common, but no name, no label, nothing. I asked her, do you know the name of the drugs you're taking? She said no. Okay, you know what's going to happen? When next you go for your visits, ask politely, in a very polite way, ask your physician what drugs you are taking. And because she mentioned some injections they give her as well, just ask him, what drugs do you take? And guess what happened? He was told, what do you want to do with the drugs? Why do you want to know? Further inquire, is he really a physician, are you sure you're not going to I don't know. And I later confirmed he works in a teaching hospital, so he's a physician. Please, this is in no way, I'm not here to call out anybody. It's not my business. I have no business doing that. But it's a little disappointing because in this age and era, it is unethical, it is dangerous, and it is a violation of the patient's rights. Yes. Please, what is really going on? And I think it's kind of a rule in some of these health facility. Is it because they don't want the patient to buy these drugs elsewhere? Is it because they want to keep the prices mysterious because they don't want it to be compared with other places? Or is it because they just don't want to be questioned? That would be arrogance. Or is it because they don't want to be challenged? Honestly, I feel it's just a poor understanding of what patient-centered care is. Every patient deserves to know what they are being treated for, the results of the tests, the investigations they carried out, the name of the drugs they are taking. It is their legal right. It's not even a favor. It is their right to know. And this is very important because you cannot watch out for side effects. How would you even tell? Okay, you didn't tell the patient the name of the drug. What if there's a potential side effect or an adverse drug reaction? How would the patient report it? There's no way for them to report it because they don't know the name of the drug. In case they want to seek a second opinion, in probably there's an emergency and they want to seek a second opinion, then how would they do that when they do not know the name of what they are taking? How would the future physicians, how would the future healthcare providers help when there is an emergency for these patients? However, this is a message to you watching me. You have the right to know the name of what you're taking. You have the right to know the diagnosis, what you are being treated for. You have the right to know the results of the tests that you carried out, those investigations you carried out. You have the right to know the results of those investigations. You should ask questions. It's not prying into their job. No, it's not prying into anybody's job. It is you trying to be informed about your health. It is a journey. The journey of being diagnosed, the journey of being treated, the journey of being investigated, the journey of up to the point of getting that desired outcome. It is your right as a patient to know all of this. You should not be kept in the dark. And to my fellow healthcare providers, honestly, being transparent do not reduce your authority. However, it helps the patient trust you. It helps you build trust between you and the patient. It helps the patient more likely to adhere to the medications, comply, adhere to other lifestyle changes. It helps you achieve that desired outcome. At the end of the day, we aim for a particular health desired outcome. Please let's stop this outdated secrecy in medications, hiding what they take, not telling the patient the status of their health. It's very unethical, and it is high time we stopped it. The era of just take it is gone. If you're still doing it, then you're still left behind. So, Hajia Allergy, I hope you take charge of your health and be glad you did. I'll see you in my next video. Thanks for watching.